everybody, today we're going to talk about National Medical Enterprises. National Medical Enterprises, also known as NME, is a diversified healthcare company with interests in acute care hospitals, nursing homes, psychiatric hospitals, substance abuse treatment centers, rehabilitation hospitals, home health care, durable medical equipment outlets, and a variety of other healthcare-related enterprises. NME has had a lot of history, but something that we're going to focus on today is the fraud that they have committed and scandals that they have been in. In the early 1990s, NME was accused of committing fraud by admitting thousands of psychiatric patients who didn't need hospitalization and then charging those patients inflated prices. In 1991, the federal government investigated the company for fraud and conspiracy. That brings us to profits over patients. In America, there's been a discussion for a while whether for-profit hospitals are providing more effective care or simply prioritizing profits over patient outcomes. Both for-profit and non-profit hospitals operate in a similar fashion, but they're tasked with a few different obligations. For-profit hospitals must make a return for their investors as well as pay taxes, whereas non-profit hospitals need to provide community benefits in lieu of paying taxes. Because of the focus on cost efficiency, it usually results in a cultural difference. The culture at for-profits is business-driven, and the culture at non-profits is service-driven. Many believe that the quality of care at for-profit hospitals is lower than the quality of care found at non-profit hospitals. The reason is that the profit that is being received motivates doctors and administrators to take on more patients and prioritize money-making procedures, however, then discourage care for uninsured patients and those that require costly services. If you struggle to talk about mental health and/or suicide, I suggest that you stop the video now. This then brings us to the Scheck family. In 1992, a unit of National Medical Enterprises admitted responsibility for the death of a 13-year-old girl who killed herself at a company-owned psychiatric facility in Chula Vista. It is the first admission of responsibility of nearly 150 lawsuits alleging physical mistreatment and abuse of patients that NME has faced since the late 1980s. The Santa Monica-based hospital firm has settled about 75% of these cases, but has never admitted responsibility. NME's admission came from an out-of-court settlement filed in 1993 by Robert and Mary Scheck, whose daughter Christy killed herself at a Southwood psychiatric center. Christy was an incredible student. However, after the death of two family members and a teacher, Christy started acting out. She was running away from home as well as shoplifting. After she slashed her wrist, her parents admitted her to Southwood because they were worried for her safety. 4 months after she was admitted, Christy used a bathrobe sash to hang herself at a Southwood facility. She died 2 days later. Christy's death was the result of negligence, mismanagement, and outrageous and despicable conduct on the part of Southwood and the Psychiatric Institutes of America. Part of that mismanagement was their cost-saving methods. To keep the costs down, their Southwood staff was comprised of mostly inexperienced and underqualified workers, some of whom were part-time employees and student interns. NME began their cost reduction program about a year before Christy was admitted in response to economic pressure in the mental health industry. NME believed that her death was not affected by the cost containment program. Something that her parents said is that there would never be an amount that could bring back Christy, but how the admission of responsibility gives some sort of satisfaction. I really think it's crucial to talk about what's happening in hospitals because a lot of the time you never know really what is going on. A lot of things happen behind closed doors. I think the more we know, the more we can hopefully prevent those incidents.